Very good afternoon to one and all present here. I feel very honored to welcome you all for the third day of All India Online Physiology Festival 2020. Myself, Dr. Divya, postgraduate student in the Department of Physiology, Lady Harding Medical College. On behalf of organizing committee, I would like to thank all the audience and the participants for gracing today's occasion with us. We hope you all have enjoyed past 2 days event, skit and poetry. To start today's event in animation category, I request Dr. Sunita Mondal ma'am, Head of Physiology Department, Lady Harding Medical College, and also the organizing chairperson of this festival to say a few words. Ma'am, please.
Thank you, Dr. Divya. So, very good afternoon to all present today on this very special occasion of All India Online Physiology Festival 2020. And on behalf of the team of Department of Physiology, LHMC, I, Dr. Sunita Mandal, Head of the department, have a great pleasure in welcoming the students and faculties of various medical colleges from all over India. Today is the third day of our journey with you, and we are going to find our students, medical students, showcasing their talent in making animations. And as you all know, that this is an all-India, pan-India competition. So I'm really excited to welcome our distinguished guests who have agreed to judge our sessions today and share every moment of this wonderful function with us. I welcome Dr. A.K. Jain, Head of the Department of Physiology. Sir is joining us from NDMC Medical College, New Delhi. I welcome you, sir.
Thank you, madam.
Thank you, sir. So I welcome Dr. Manju Sabharwal. Madam is the head of the Department of Biochemistry and is joining us from GV Pant Hospital, New Delhi. I welcome you, ma'am. So now I hand over the platform to Dr. Madhulika and Dr. Anita Pawar, professors of Department of Physiology, to continue with the program. Thank you so much.
Thank you so much.
Over to you, Dr. Madhulika and Dr. Anita.
Thank you so much, ma'am. Divya, am I audible?
Yes, ma'am.
Thank you, sir. So good afternoon, all. I, Dr. Madhulika Munga, welcome you all to the third day of our festival. And I thank you all for joining us today. Over the last 2 days of our All India Online Physiology Festival, we have had the live streaming of the skit and poetry category. Today, we would be having the competition for the animation category. We are humbled by the enthusiastic participation by the undergraduate students and awestruck by their creative brilliance. On behalf of the Department of Physiology, LHMC, we congratulate the undergraduate students from all over India for such fervent, wholehearted participation. Learning is creation, not consumption. Knowledge is not something a learner absorbs, but something a learner creates. This was said by George Couros, a leading educator and author in the area of innovative leadership, teaching, and learning. And today, to see our young budding doctors at their creative best fills us with pride and assurance to know that the future of our country's health is in hands of these students who have learned to create. Time will surely tell us the beautiful stories of success that these students will create, and we would witness. Today, let's witness the talent of these students showcasing the physiological concepts via the medium of animation. The participants have submitted their respective entries in the form of video, which would be played one after another on YouTube. The time limit for each video is 5 minutes, and we have 3 prizes for this category as well. First, second, and third, which would be decided and judged by our judges for the day. And we also have an Audience Choice Award, and the link for the same has been opened and has been shared in the description box. The voting would start as soon as the first video, the link, as I said, is already open and the link would be closed within 30 minutes of end of the screening of the last entry. The announcement of the prizes for all the categories would be announced together on the last day of our festival, which is tomorrow, 10th December. Now, I will begin by introducing our esteemed judges of the day. It is an honor to have with us Dr. A.K. Jain, Director, Professor and Head of Department Department of Physiology, North Delhi Medical College and Hindu Rao Hospital, New Delhi. He is our esteemed judge today. And although Sir needs absolutely no introduction, as he is known all across India, especially loved by all our undergraduate students, but I shall surely not let this opportunity slip by. So he was former professor and Dean Faculty of Applied Sciences, Maharashtra International Institute of Research and Studies, Faridabad, and former Professor of Excellence and Head of Department of Physiology, Maulana Azad Medical College, New Delhi. He has over 42 years of service. Dr. Jain is known as an academician and outstanding scholar in the field of physiology and has been deeply involved with development of quality of medical education. He has also worked in our institute, Lady Hardinge Medical College, New Delhi, and that has been, it's a proud moment for us that he has also been working with us. He has the unique distinction of being honored with many prestigious awards. Some of the worth mentioning awards are Guest of Honor Award for delivering various lectures like 14th Professor Avtar Singh Pental Memorial Oration Lecture, Lecture on Research Methodology in Basic Surgical Skills at Pilibhit, Lifestyle Intervention in Stress-Related Disorders Lecture at our institute. These are just to name a few. He has been awarded Alumnus Award 2013 by MAMC, New Delhi, for outstanding contribution to the growth in the field of physiology in India, and has also been awarded Most Inspiring Educational Author by ASSOCHAM, India, by former Union Cabinet Minister and Governor Assam and Tamil Nadu, Shri Bhishma Narayan Singh, in the year 2012. Besides publishing a number of papers in various scientific journals, he has authored as many as 87 books since 1996 in the subject of physiology, and all of us have certainly read at least one of his books. His accomplishments, awards, distinctions are so long that it would probably take a whole evening just to mention all of them in a go. He has nurtured more than 2 lakh health-related professionals during his 41 years of service, and the health and society enjoys, the health that the society enjoys today is the result of hard and sincere efforts by doctors like Sir. Thank you for joining us today, sir. It is indeed an honor to have you with us, and the students would be absolutely delighted to have you with them today. Thank you, sir.
Thank you, Dr. Madhulika. Thank you all. So much is said. I have no words how to reciprocate my feeling. Thank you.
So we are the ones who are honored by your presence, sir. Thank you so much.
Always you'll enjoy this. Thank you.
Thank you, sir. Thank you, Dr. Madhulika. Now I'm Dr. Anita Pawar, Professor, Department of Physiology, Lady Hardinge Medical College. Now it gives me an immense pleasure to welcome Dr. Manju Sabharwal, Head of the Department of Biochemistry, Govind Vallabh Pant Institute of Postgraduate Medical Education and Research, Delhi. Dr. Manju Sabharwal has done her MBBS from Lady Hardinge Medical College and her post-graduation in biochemistry from Maulana Azad Medical College. Now, just would like to share some personal things that I've known Dr. Manju from the first day we landed in Lady Hardinge for our admission. So both of us are batchmates, and we have been close friends since the time we first met. And I always have been in a total awe of her passion and skill for the zillion things she can do. To name few, she's a very good painter and an amazing sculptor. In fact, once I saw her collecting wax from her Diwali candles, and she was collecting it in a powder can. And then she carved it into a beautiful lady with a fine and delicate features, just using a simple scalpel. I don't know whether, Manju must be surprised, but I remember this and I saw the sculpture.
Yeah, I'm
and
surprised.
I've been in awe of her. but she's heading the Department of Biochemistry at Covid GB Pant Hospital. And despite being a full-time doctor, her passion for animation drove her, and she finished her graduation in character animation from Animation uh, Mentor, which is an online school located in America, where professional animators working at major studios like Disney, Pixar, and DreamWorks are teaching as mentors. Students are supposed to create animation under their supervision and guidance. And she's won a best film for her independent film, Second Puran, in Creative Minds competition, where animators from all over India come to compete. She also won a Best Character Animation for her film Second Puran and Kal Ratri, which she created independently for 2 consecutive years. Her film Kal Ratri on Ma Kali has over 9 lakh hits on her YouTube channel. She then learned directions from Institute of Moving Images in Mandi House for 1 full year. And while studying there, she also won Best Director Award in Fallen Joy short film. And now she's producing and directing her own films. And for her short film, Yours Unfaithfully, which was made in 2019, she won Best Female Director at International Film Festival Pune and a Best Film at Shunya International Film Festival. And it was selected for screening in over 6 prestigious international film festivals. I welcome you, Dr. Manju. It's a extreme pleasure to have you with us today. And I welcome all of you once more. But before we start the competition, I would request all of you to keep your comments logo off on the right top corner of your YouTube screen, so that any comments if posted does not hinder the video screen. And I welcome all of you once more. And without any further delay, I would request Dr. Mayank, our senior resident and a coordinator for the animation category, to start with the competition.
Thanks, Dr. Rita.
A very warm good afternoon to everyone, and thank you for joining us at the All India Online Physiology Festival 2020. I would like to thank our esteemed director, Dr. N.N. Mathur, Head of Physiology Department, Professor Sunita Mandal, Professor Madhulika Monga, and Professor Anita Pawar for giving me the opportunity to act as a coordinator for the animation category. We got 20 number of entries, and we are delighted with the enthusiastic participation of the UG student we got from Pan India. I would like to remind the audience that the voting link is given in the description box, which will not be active, and it will be active once live streaming is started, and it will close half an hour after the live streaming is over. Kindly do vote and support your favorite presentation. Without wasting any further time, I will start the live streaming of our first team, 100 Degrees, led by Roshan A from Savita Dental College, Chennai.
The first, such as adenosine diphosphate ADP. By binding to its receptor, ADP induces aggregation and recruits further platelets to the site. Thromboxane is another important mediator of platelet activation and aggregation. Under its influence, the platelet cross-links with each other. These interlocking mechanisms cause platelet activation to snowball. The clot grows rapidly. Activated platelets also trigger the coagulation cascade and thus the formation of thrombin. Thrombin in turn stimulates platelet activation even further, a continuous feedback loop. Additionally, thrombin induces the formation of fibrin for a mesh, stabilizing the clot, self-reinforcing process of platelet activation. Crucial in the formation of the blood clot is an obvious appropriate triggered blood coagulation. Now, these visuals are a gist of the blood clotting mechanism. First, there will be a formation of platelets. These platelets then bind with the red blood cells. These fibrins and the platelets both gel together, and they form a fibrin structure. Thank you.
That was a well-made core physiology topic on blood clotting by team 100 degrees. Our next team is Medic Rodzinians led by Vikas Kumar from Atal Bihari Vajpayee Institute of Medical Sciences, Delhi.
Story of acquired immunity by Medic Rodzinians.
I'm Baku. Yay! Today is our last exam. After that, we will go on food exploration. Pani puri, imerti, yum yum. Wow, this food is amazing. Yummy.
Somehow pathogens enter into his body via oral cavity.
I am not feeling well.
I'm Parthogenia. Our new home, yay. I will infect this host body. Too much fun and adventurous, at the same time, guys. I have to multiply in host cell, otherwise, I will not be able to colonize the cell.
Biku's body has two systems to fight with invaders. Parthogenia somehow managed to full innate immunity. It enters into tissues and start multiplying.
Hey, I'm macrophage. I am one of the members of antigen-presenting cell. She is the invaders. We have to kill them, otherwise they will harm us. I will digest it, and I will present the partially digested antigen among my colleagues.
Please leave me, macrophage.
Yay, I have killed the invader. I will celebrate this victory. See, I have killed it finally.
I am helper T cell. How's that possible? Our family is the strongest. How did macrophage manage to catch invader before us? I have to collect information about this invader. Later on I will pass this info to B cell and killer T cell. Thank you so much, Interleukin 1.
I am killer T cell.
Macrophage has killed the invader before us. We have to do something now. We are the strongest.
Tell me information about the pathogens. I will kill everyone.
Hey, I am B cell. I produce antibodies that helps in killing pathogens.
I am Suppressor T cell.
Chill, killer T, you have done tremendous work. You have killed every pathogens.
But now you are damaging your own people, your own cell. Relax and go to some vacation. I have to pass this info to helper T cell too.
Yup, it was a bit challenging. I am happy I was able to eradicate these pathogens.
I am memory T cell. I have a photographic memory. I have seen this war and have precious information about antigens and antibodies. Now I want peace. I want peace.
Are you okay now?
I am feeling well because of my B and T cell. Thanks for asking. Well, you would like to have latte or espresso?
That was Acquired Immunity made interesting by Medic Rodzinians. A gentle reminder for all, please do vote and support your favorite presentation. Our next team is Tech Doctors led by Mukul Agarwal from University College of Medical Sciences, Delhi.
This guy is a hero, but he just doesn't know it yet. When the time comes, he will step up. So that's how our hero saved a life. By a technique called cardiopulmonary regurgitation, also known as CPR. Now let's see how CPR works. With the cardiac pump mechanism, the heart is directly compressed between the sternum and the spine. This pushes the blood out. More importantly, the chest also becomes a thoracic pump. Chest compression creates a positive pressure that pushes the blood out of the heart and air out of the lungs. Compression also slightly increases the intracranial pressure, which reduces cerebral perfusion. During decompression, the chest wall passively recoils, putting a slight negative intrathoracic pressure. Decompression creates a negative pressure gradient or a vacuum, which pulls blood back into the heart, increasing its preload, some air back into the lungs, increases the coronary artery blood flow, and also slightly lowers the intracranial pressure. Chest compressions creates a sequence of alternating positive and negative pressures that help to circulate the blood. The more blood that can be returned to the heart, called preload, the more blood that can be circulated forward on the subsequent compression. Optimizing the preload is critical for maximizing the effectiveness of high quality CPR. CPR alone is not enough to maximize the amount of blood that is circulated, because just as the chest wall begins to recoil, the air rushes in through the open airway and eliminates the vacuum that is required to fill the heart. Once the negative pressure is gone, the heart stops filling, and this leads to decreased preload and decreased cardiac output on subsequent compressions. So that's how our hero saved a life, and you can also be a hero. Thank you.
That was a good illustration of an essential technique, that is cardiopulmonary resuscitation by tech doctors. Our next team is Heartthrobs, led by Riddhi Mehta from Lady Hardinge Medical College, Delhi.
Hello friends, Team Heartthrobs of Lady Hardinge Medical College presents you When Blood Met Oxygen.
Hey, I am blood. I have supplied oxygen to the whole body. I look a little dull now and feel deoxygenated. I think I need to freshen up a little now. Look there! A new gas saloon named Lungs has been opened up in Thoracic City.
Hello sir, welcome to our salon Lungs. We have 2 branches with 600 million employees like me working day and night to serve you.
The exchange of gases took place.
Thank you for your incredible service, Alveolus. I look so bright red and beautiful now.
Hello, blood. Follow this path to see the magic of oxygen.
Oh, I am excited to go. Yippee! Look there. That door leads to the chambers of heart. Whoa, I am going inside.
Welcome. You have entered the chambers of heart.
This is chamber number 1, left atrium.
Thanks, but this chamber is too small for me to fit in.
Yes, soon bicuspid valve will open for you to enter the bigger chamber.
Oh.
The bicuspid valves opened, but a problem occurred.
Welcome to chamber number 2, left ventricle.
Help me! Help me! Some of my part is still stuck in first chamber.
Don't worry. A technology named nodal tissue will soon pump down your remaining parts.
Thank you. Now I feel complete.
Now you have to move round the whole body and distribute oxygen.
Okay.
Cross semilunar valve to start your systematic circulation. Strong muscles of my chamber will help you overcome gravity and boost you up.
Go, blood, go. Body parts are waiting for you.
Yay, I'm ready. I should split up myself according to metabolic needs of tissues and organs. Hard work done. Oh, another similar gate in the path, but I feel too weak to go there.
Go, blood. My walled path will prevent you from falling back.
Okay, here I enter.
Welcome. You have entered the chambers of heart.
This is chamber number 3, right atrium.
Oh, another small chamber, and I am again unable to fit in.
Similar mechanism works here too. Due to your pressure, tricuspid valve will initially let your 70% part enter into the bigger chamber. Later, nodal tissue will help pushing down your remaining parts.
Okay.
Welcome to chamber number 4, right ventricle. What happened, blood? Why are you so upset?
My oxygen was used up by body organs. I look dull now.
I have a solution for that. Cross the semilunar valve to right pulmonary artery path. The nodal tissue will help you in this process. Pulmonary artery will directly take you to lungs. It is a new gas saloon open in thoracic city. They have an exchange system to convert your carbon dioxide into oxygen. Also, you will become bright red and beautiful again.
Yes, I have been to that saloon. Thanks for solving my problem. Bye. Here I go.
And the cycle continues. Thank you.
That was a beautifully depicted story about when blood meets oxygen by heart throbs. Our next team is Reminiscence, led by Shashwat Jaiswal from Pravara Institute of Medical Sciences, Maharashtra.
Walking Down the Memory Lane, by Team Reminiscence. Memory is the diary we all carry about with us. Have you ever wondered why we cannot remember everything we encounter in our day-to-day life? You might be thinking it is obvious because forgetting is in human nature, we are prone to forget things. But do you know Jill Price, the first woman to be diagnosed with hyperthymesia, was able to retain all of her memory of every single day since the age of 14. Now, let me tell you a contrasting case of patient HM. In an attempt to cure his epilepsy, he had undergone bilateral removal of hippocampus and neighboring regions in medial temporal lobe. Although the surgery was partially successful, a severe repercussion was that he became unable to form new memories. After looking at these two extreme cases, the most potent question that may come in one's mind is, what exactly is memory? Memory is the ability of the brain to take in information, store it, and recall it later when necessary. Have you ever given a thought on why one is able to remember some of their childhood memories so clearly, while forget what one reads recently, or why one remembers few events so nicely, and not others, or why we remember people we meet often and forget others? Answers to these innumerable questions can be explained through classification of memory. Memory is basically of three types: sensory memory, short-term memory, and long-term memory. First of all, we will see what is sensory memory. Sensory memory is a very brief mental representation of how environmental events are felt by our senses, that is, how they look, sound, feel, smell and taste. Out of all types of sensory memory, three are studied in details, that are iconic, echoic and haptic. Let's begin with iconic memory. Iconic memory is the fast-decaying visual sensory memory. For example, when one moves a sparkler rapidly, it leaves a light trail. Now, let's do an activity. Take a quick look of objects around you, then, close your eyes and try to recall what you saw. Things you are able to recall is your iconic memory. Secondly, let's see haptic memory. Haptic memory is the fast decaying memory of tactile sense of touch. Example, remembering how fur of dog felt. Lastly, in sensory memory is echoic memory. Echoic memory is fast decaying memory for auditory sense of hearing. Example, listening to numbers for mental association of numbers, or listening to music and associating lyrics in mind. Now we will shift our focus towards short-term memory. Short-term memory is the capacity for holding a small amount of information in an active, readily available state for few seconds to few days, considering repetition is allowed. For example, what you had for lunch today, or where did you park your car? Now let's try to understand short-term memory by another activity. Listen following numbers and try to remember them. 751492. So was the number 751492? If you are able to remember the number, then that's because of your short-term memory. Finally, let's proceed towards the last type of memory. Long-term memory. Long-term memory is the memory responsible for the storage of information for an extended period of time. Types of long-term memory: implicit or non-declarative memory, and explicit or declarative memory. Further, explicit memory is of two types: episodic and semantic, starting with implicit memory. It is acquired type of memory, used unconsciously and involves procedures for completing actions. For example, riding bicycle, brushing teeth, and typing on a keyboard. Now, let's see explicit memory. It is the conscious, intentional recollection of factual information, previous experiences, and concepts. Proceeding towards semantic memory. It is memory of general world knowledge that one accumulates throughout one's life. For example, memory of historical knowledge, geographical knowledge, general knowledge, or how to use a phone. Lastly, let's see episodic memory. It is the memory of past personal experiences that occurred at particular time and places. For example, recalling last family function you attended, or where you were when earthquake occurred, or your first day of the college, or last family trip you went on. At last, memory can be correctly described as forbidden to remember, terrified to forget. It is a hard line to walk on. You think you have a memory, but it has you.
Well, that was Memory Made Easy to Remember by Reminiscence. Our next team is the Pulse, led by Bipin from Savita Dental College, Chennai.
The cardiac cycle is defined as a sequence of alternating contraction and relaxation of the atria and ventricles in order to pump blood throughout the body. It starts at the beginning of one heartbeat and ends at the beginning of the another. The process begins as early as the 4th gestational week, when the heart first begins contracting. So there are 4 phases in cardiac cycle. The first is atrial diastole. Is the very first event of the cardiac cycle. It occurs some milliseconds before the electrical signal from the SA node arrives at the atria. The atria functions as conduits that facilitate the passage of blood into the ipsilateral ventricle. They also act as primers to pump residual blood into the ventricles. During atrial diastole, blood enters the right atrium through the superior and inferior vena cava and the left atrium through the pulmonary veins. There comes a point when the pressure in the atrium is greater than the pressure in the ventricle of the same side. This pressure difference results in the opening of the atrioventricular valves. The second is atrial systole. The autonomous sinoatrial node initiates an action potential that is propagated throughout the atrial myocardium. The electrical depolarization results in simultaneous contraction of the atria, thus forcing any residual blood from the upper chambers into the lower chambers of the heart. Then, ventricular diastole. During the early stages of ventricular diastole, both the atrioventricular and semilunar valves are closed. During this phase, there is no change in the amount of blood in the ventricle, but there is precipitous fall in the intraventricular pressure. Ventricular systole refers to the period of contraction of the ventricles. The electrical impulse arrives at the AV node shortly after the atria are depolarized. There is a small delay at the AV node, which allows the atria to complete contracting before the ventricles are depolarized. Action potential passes at the AV node down the bundle of his and subsequently to the left and right bundle branches.
That was a beautiful animation of cardiac cycle by the team Pulse. Our next team is Symporters, led by Sai Anirudh Atulari from Rangaraya Medical College, Andhra Pradesh.
Speech is a higher intellectual function that helps us express our feelings and convey our thoughts. Powerful speeches by leaders throughout history have influenced thousands of people and their mindset. Hence, it is important that we understand the physiology behind this beautiful phenomenon. Speech is defined as the ability to understand written and spoken words and to vocalize one's thoughts and ideas. From this definition, it is clear that speech has a sensory component involving the ears and the eyes, and a motor component involving vocalization and its control. Now, let's look at the areas of the brain related to speech located in the categorical hemisphere. It is also conventionally called the dominant hemisphere, and it is the left hemisphere in 96% of the right-handed people and also in some left-handed people. A region at the posterior end of the superior temporal gyrus called the Wernicke's area is concerned with the comprehension of both auditory and visual informations. This area projects into the Broca's area in the frontal lobe through the arcuate fasciculus. Broca's area processes this information into a coordinated pattern for vocalization and then projects this pattern to the motor cortex. The motor cortex then initiates appropriate movements of the lips, tongue, and larynx to produce speech. The angular gyrus processes visualized words and sentences into the auditory and analytical forms in the Wernicke's area. After the sensory component of speech is finalized, and after the Broca's area performs its motor functions, there are two mechanical functions of speech that take place: the laryngeal phonation and articulation. These are the non-respiratory functions of the respiratory system. During phonation, the vocal cords move together so that the passage of air between them causes vibration, thus producing sound. The pitch of the sound produced is determined mainly by the degree of stretch of the cords and also by how tightly the cords are approximated to one another. The oral, nasal, and pharyngeal resonators help in speech articulation by modulating the voice quality. This can be understood by the change in voice quality of a person having a severe cold that blocks the air passage to these resonators. Now, let's summarize the principal neural pathways for speech. In the pathway involved in hearing and speaking, the sound signals are first received in the primary auditory area. Then, the related thoughts are formed and interpreted into words in the Wernicke's area. Signals are then transmitted to the Broca's area through the arcuate fasciculus, and then skilled motor movements for control of word formation are activated in the Broca's area. Finally, the appropriate signals are transmitted to the motor cortex to control the speech muscles. For reading and then speaking in response, the initial receptive area is the primary visual area. Information then passes through the early stages of interpretation in the angular gyrus and finally reaches its full level of recognition in the Wernicke's area. From here, the signals again pass to the Broca's area and finally to the motor cortex. The beauty of physiology lies in learning the normal to understand the abnormal. So now that we've learned the normal, let us discuss the abnormalities of speech termed aphasias. In non-fluent or motor aphasias, the lesion is in the Broca's area. The patient can comprehend words but speaks very slowly with difficulty, using only a few words. When asked how he is feeling, the response may be
tired from work.
In one form of fluent aphasia, the lesion is in the Wernicke's area and the comprehension of words is lost. While the motor speech is fluent, it is full of neologisms that make little sense. If you ask the patient how he is feeling, he may respond with something like,
I and the Levantine food are happy, we talk.
There is another form of fluent aphasia in which the patients can speak and comprehend well but cannot repeat the words together. This is called conduction aphasia because it is due to lesions in the arcuate fasciculus that connects the Wernicke's and Broca's areas. When a lesion damages the angular gyrus, there is trouble understanding written language or pictures because visual information is not processed and transmitted to the Wernicke's area. This is called anomic aphasia and most commonly manifests as dyslexia. These are the references that we have used for this video. This brings us to the end of this video. Thank you and hope you found this informative.
Nicely portrayed the physiology of speech by Symporters. Requesting viewers to keep voting. Our next team is Peaky Climbers from PRK, led by PRK Tanmay from Osmania Medical College, Hyderabad.
Hi, I am Mia. Have you ever wondered about the difficulties people face while trek? Don't worry. We've got you covered. This is Jim and Jake. They're going on a trek after a few days.
Much later.
They'll get peaky as they ascend. They begin to experience fatigue, dyspnea, and palpitations.
Yeah, I'm too sick. You'll rest here. You continue.
One eternity later.
Oh my god.
Eventually.
Here are a few trekking tips.
That was High Altitude Physiology, made easy by Peaky Climbers. Our next team is Faces of Aphasia, led by Abhinav Deshpande from Surabhi Institute of Medical Sciences, Siddipet, Telangana.
Well, have you ever seen people who speak short or incomplete sentences? People writing or speaking words or sentences that don't make sense, or maybe difficulty in finding the right words to speak or write. That probably is aphasia. Hey, this is our team. The Phases of Aphasia includes Abhinav, Chidakasha and Grishma of first year MBBS, Surabhi Institute of Medical Sciences. We are here to discuss Broca's aphasia in detail. So without any further delay, let's get started. Before getting started with Broca's aphasia, let's know what aphasia is. Aphasia. Aphasia is defined as an acquired impairment in the use of language due to damage to frontal or the temporal lobes of the brain. This damage could be caused by injury, tumor, stroke, or seizures. Generally, people with aphasia have difficulty in speaking, reading, writing, and understanding. It is estimated that approximately 1 million people, or 1 in 250, suffer from aphasia. So, types of aphasia. There are 3 types of aphasia. Type 1, motor aphasia or non-fluent aphasia, or commonly known as Broca's aphasia. Type 2, sensory aphasia or fluent aphasia, or commonly known as Wernicke's aphasia. Type 3, global aphasia. This condition is produced as a result of damage in both Wernicke's and Broca's areas. Now let's get back to our prime concept, Broca's aphasia. Broca's aphasia is also known as expressive aphasia. As the name suggests, individuals with this conduct struggle with expressing themselves. It is caused by damage to Broca's area, which is made up of Brodmann's area 44 and area 45. Let us get a clear understanding of how Broca's aphasia affects with a case study.
An 80-year-old Japanese woman was riding a bicycle when she suddenly felt unwell and subsequently noticed she could not find words to express her thoughts. A pedestrian found her sitting on the ground looking confused. The pedestrian assisted her to the emergency department for evaluation. On examination, she looked very anxious, frustrated, and confused. She was not oriented to time, place, and person. She spoke hesitantly and non-fluently. She seemed not to be able to find words to respond to the physician's questions. She also showed impairment in repetition and comprehension of questions with complex syntax. The rest of the neurological examination was normal. Laboratory studies showed high cholesterol and elevated glycated hemoglobin. The physician suggested getting an MRI done. MRI revealed acute infection involving the Broca's area. MRI angiography showed severe stenosis of the distal left middle cerebral artery. The woman was diagnosed with pure motor aphasia or Broca's aphasia. She was suggested speech therapy as the treatment. Broca's aphasia is characterized by severe impairment in expressing speech and writing. Comprehension is sometimes affected. Broca's aphasia stems from neurological damage to the Broca's area. The differential diagnosis is broad, encompassing vascular, infectious, inflammatory, or degenerative conditions. Diagnosis includes detailed medical history, physical examination, and the neurological tests like MRI. Language and speech tests are also done. The patient suffering from aphasia undergo speech and language therapy to rehabilitate their language skills and supplement the communication experience. Researchers are currently investigating the use of medication alone or with the speech therapy to help the people with aphasia. Aphasia affects language comprehension, but it doesn't impair intelligence. Thank you.
That was a good animation on types of aphasias by Faces of Aphasia. Our next team is I Am Munitas, led by Sautam Bhattacharya from Institute of Postgraduate Medical Education and Research, Kolkata. That was a nice illustration of immune system by I am Munitas. Our next team is Revert, led by SS Samhita from ESIC Medical College and Hospital, Hyderabad. Also reminding viewers to keep voting. Thank you. Good work, team Reward, on the physiology of stress. Our next team is Antiques Taught Physiologics, led by N. Sai Jyoti Swaroop from Sri Venkateshwar Medical College, Andhra Pradesh. That was a good illustration on mechanism of hearing by Antiques Physiologics. Our next team is 4AB Vitals by Anurag Singh from NAMO Medical Education and Research Institute, Silvassa.
Renin-angiotensin-aldosterone system is a vital system in our body that is responsible for long-term regulation of blood pressure.
Renin-angiotensin-aldosterone system involves three hormones: renin, angiotensin II, and aldosterone. This system mainly involves following organs: adrenal gland, kidney, lungs, brain, and blood vessels.
Mechanism of action of renin-angiotensin-aldosterone system. When there is decreased blood flow to the kidney or low sodium concentration in early part of DCT of nephron, it is sensed by the macula densa cells.
Macula densa cells. These cells are long, cylindrical, closely packed, specialized cells which detects low sodium concentration and are present in the glomerular apparatus of nephron.
The role of macula densa cells. These cells releases renin. Renin further acts upon angiotensinogen. Angiotensinogen, an alpha globulin, is synthesized and secreted by the liver. This is present in fraction of plasma. Angiotensinogen is converted into angiotensin 1 by renin. Angiotensin 1 is further converted into angiotensin 2 by the action of angiotensin converting enzyme.
Angiotensin converting enzyme is present in the pulmonary endothelium capillary. ACE2 is synthesized by type 2 pneumocytes. It inhibits bradykinin, which prevents vasodilatation.
Action of angiotensin 2 at PCT. Angiotensin 2 increases transport of sodium from lumen into cells. This transport is mediated by G protein and cyclic AMP. This enhances sodium hydrogen antiporter. Sodium absorption is followed by water absorption. This increases the blood volume, which in turn increases the blood pressure.
Action of angiotensin 2 on adrenal cortex. Angiotensin 2 acts on adrenal gland located above kidney. Angiotensin 2 causes release of aldosterone from zona glomerulosa of adrenal cortex. This aldosterone acts on DCT and causes increased sodium and water reabsorption. This causes increase in blood pressure.
Action of angiotensin 2 on blood vessels. It can be divided into action on arterioles as well as action on veins. Action on arterioles. Angiotensin 2 causes constriction of arterioles. This increases the total peripheral resistance, which in turn increases the diastolic blood pressure. Action on veins. Angiotensin 2 causes constriction of veins. This results in increase in venous return and cardiac output, hence increasing the systolic blood pressure.
Action of angiotensin 2 on brain. It is divided into action on hypothalamus and action on pituitary gland. Action on hypothalamus. Angiotensin 2 stimulates thirst center located in lateral hypothalamus. Stimulation of thirst center causes increased desire to drink and thus increased water intake. Increased water intake results in increased blood volume and therefore increased blood pressure. Action on pituitary gland. Angiotensin 2 stimulates release of antidiuretic hormone from posterior pituitary. Antidiuretic hormone acts on collecting tubule and causes reabsorption of water by activation of aquaporins. This results in increased blood pressure.
Let's discuss about the clinical applications of renin-angiotensin-aldosterone system. First, hypertension. Second, diabetes mellitus. And third, COVID-19. Hypertension. ACE blocker inhibits formation of angiotensin 2, which prevents constriction of blood vessels and helps them to relax, hence reducing the blood pressure.
Diabetes mellitus. In diabetes mellitus, ACE receptors are increased. Increased ACE receptors results in increased amount of angiotensin 2. Long-term increase in angiotensin 2 causes hypertension, so uncontrolled diabetes mellitus is often associated with hypertension.
COVID-19. SARS-CoV-2 binds to ACE2 receptors in type 2 pneumocytes. In this way, virus enters and then multiplies. Virus causes increased accumulation of angiotensin 2. Accumulation of angiotensin 2 results in complications like hypertension, heart failure and renal failure.
Thank you.
Nicely depicted renin-angiotensin-aldosterone system by 4AB vitals. Our next team is Vision by Shivangi Thakur from Government Medical College, Siddipet, Telangana.
Hey guys, so today we are going to present antagonistic effects of hormones. Let's check out the war which is going inside our body to keep us in a healthy state.
It's time to prove your worth. Glucagon, such a sweet hormone, loves sweetness all around. But insulin, not going to take this easily. Insulin, gonna act against glucagon. Let's check this out. Glucose all around. Insulin, gonna clear them from surroundings. As glucose level rises, insulin commands them to move into tissues. Insulin governs systemic glucose metabolism, including glycolysis, gluconeogenesis. This clash between insulin and glucagon will continue to maintain blood glucose homeostasis.
It's now time to witness another battle between the PTH and calcitonin. Hey calcitonin, I will not let you to decrease the blood calcium level. I will surely prevent the hypocalcemia. Haha, is that so PTH? Let's see what you can do. I will increase the blood calcium level. Hey osteoclasts, help me to release the calcium ions from the bones directly into the bloodstream. Oh kidneys, help me to conserve the calcium ions. Reabsorb them. Go calcium, go back into the bloodstream. Hey intestine, help me absorb the calcium ions with the help of my friend calcitriol. Wake up, alpha hydroxylase synthesize more calcitriol from the kidneys. Now it's my turn. Hey osteoclasts, stop there and don't allow the calcium ions to escape from the bones. Hey kidneys, let go of the calcium ions through the urine, excrete them from the body.
That was interesting story about clash of hormones by Team Vision. Our next team is Budding Minds led by Nilima Sanatha from Government Medical College, Siddipet, Telangana.
Growth hormone releasing hormone, somatocrine. I'm responsible for body growth and I increase GH secretion. I show my effect on the growth by acting on protein, lipid and carbohydrate metabolism. And the winner is... You can't be the winner! I control. I'm somatostatin. And when you hypersecrete, you're responsible for all these. Imagine there's a monkey in the forest who keeps getting energy from the banana it eats and gets hurt by the stones. Everything is good if taken in limit. Same applies with the hormones. Let's take the example of somatocrine as the banana and the somatostatin as the stones. Somatocrine overproduction before epiphyseal plates fusion leads to gigantism, whereas somatocrine overproduction after epiphyseal plate fusion leads to acromegaly. Overproduction of somatostatin leads to dwarfism. Oh bhai, somatostatin, dekh le meri taakat. GH secretion is stimulated by the following factors. Hey, yahoo! ओए बेटे, सोमैटोकाइनिन, अब देख ले मेरी ताकत. GH secretion is inhibited by the following factors. Therefore, antagonism is necessary. So the hormones keep fighting like this just to maintain a healthy hormonal balance. So let's maintain a healthy lifestyle by maintaining a healthy hormonal balance. Have you ever seen a person collapsed all of a sudden, showed no signs of life, wanted to help? CPR, a lifesaver. Let's get started. Form cardiopulmonary resuscitation. Dial the nearest ambulance service, as CPR can only keep the person alive until the ambulance reaches the scene. Check with the safety of your surroundings and move the collapsed person to a safer place immediately. Then, check for the patient's response by tapping them on the shoulder and ask them whether, are you fine? If there is no response, perform CPR immediately. CPR with ABC. Yes, ABC. Airway, breathing, circulation. A stands for airway. Lay down the collapsed person in the supine position, that is recovery position. During cardiac emergency, the airway might get blocked, so clear the airway by tilting the head and lifting the chin up to clear the blockage. B stands for breathing. There are 3 signs of breathing. Look for the normal chest movements, listen for the normal breathing sense, and feel the breath against your face. C stands for circulation. Check for sternum, the V shape on the chest. Keeping your arms straight, place the heel of one hand on the center of the person's chest. Interlock your fingers like this. Push hard and fast. Keep your fingers raised so they do not touch the patient's chest or rib cage. Push fast and hard, fast and hard. Fast means to give 30 compressions at a rate of 100 compressions per minute, and hard means press down on the chest about 2 inches. After 30 chest compressions, give a rescue breath. Leave a gap of a second and give another rescue breath. Keep repeating the cycle till the ambulance arrives. For children, place one hand on the chest and perform the same CPR procedure as in adults. Infants, place the fingers as shown and make sure you're pressing down only by 1.5 inches and follow the same CPR procedure as mentioned earlier. D stands for defibrillator. Defibrillator delivers a shock to restart heartbeat. If AED, automatic external defibrillator, is available, use it as it gives commands to what to do so that you can't be wrong. In case if it's not available, continue with CPR. Once the ambulance is arrived, the person is taken to hospital. Hooray! You were a hero. You saved a life. Yes, anybody can be a doctor.
Nice portrayal of growth hormone and CPR by the budding mind. Reminding audience to keep voting. Our next team is homeostatic bodies led by Noor Bhai Wala, Mudreka, Mohammad Bhai from Zydus Medical College and Hospital, Dahod.
There was a sacred mountain, around which there were villages. The main villages were protein, carbohydrates, fats, and fibers. The villages were situated around a sacred ancient mountain, which was the living stem for all villages and entities. But to maintain this life cycle, there was a ritual. The ritual needed sacrifice from the 4 main villages. A single one from all villages need to go in the cave. The sacrifice would produce ATPs. This would maintain the life of mountain's supernatural energy, which indeed gives life to other nearby organisms. So, on the day of ritual, a villager from each place reaches to cave.
I don't know about you people, but I don't think it's a good idea to go in that cave. I am afraid too, but I don't want my family and villagers to suffer either. They will not get enough life energy.
You're right indeed. We know that for the survival of all of us, we have to go inside to generate that so-called ATPs for others. Well, I am from Fiber Village, and one thing I know is that in these caves, only our kinds are able to survive. Then hurry, let's go inside.
The cave is the human body, and the monster inside it are specific enzymes and compounds that are breaking different kinds of nutrients to form the energy compound called as ATP.
So this is Mouth Cave.
Shit! What's this? It's hurting me. It's damaging my body. That must be the salivary amylase monster. My people told me that he attacks mainly on our kind. Salivary amylase is secreted in the mouth and responsible for 30% of the carbohydrates digestion. It is mixed in the saliva produced by the salivary gland.
Hey, look, there is a way out. It's dark, but we should move on. Now!
This liquid, it's burning.
This must be the pool of gastric juices. I have heard it from my ancestors that these pools are not good for our kinds. It's deadly.
Proteins are digested by pepsinogen enzyme, which needs acidic medium for activation. This acidic pH is due to the HCl secreted by the stomach.
Where are we going? Where are we? I have listened that this is the small intestine part of the cave, and only few are known to go alive. I am the liver. I am here for the fat. My secretion will make him weak. I am bile. I will form micelle formation. Hence, pancreatic secretion can act on the fat. I am a pancreas. My secretion will convert all nutrition into small particles, and they all will be absorbed by the cave. It's me, pancreatic secretion. I am made up of trypsinogen, chymotrypsinogen, elastase, carboxypeptidase, pancreatic lipase, nuclease, and amylase. Oh no! I am breaking down. This is due to pancreatic amylase and maltase. Me too. This pepsinogen and trypsin are going to close my eyes permanently. This bile and lipase, it's lethal. I am dying. It seems that the story of survival of our kind is true. These enzymes can't kill me. Human body don't have cellulase enzyme which is needed for the digestion of the fibrous part. Hence, they are excreted mostly, but they help in cleaning of digestive tract. Fiber collected remains of his fellow and left. The cave, after getting his sacrifices, continued to produce ATPs, which maintain the life cycle of everyone.
Nicely made animation on digestion by homeostatic bodies. Our next team is Diabetes, led by Rupendra Singh from Dr. Sampurnanand Medical College, Jodhpur.
Hey, I am Glucose. I love children's and festivals. Lots of sugar. Lots of me in the blood. Hi. Girls call me sweet. But I hate one person who can't see me happy floating in this blood. It is insulin. Insulin. Insulin lives in this pinkish, spongy house called pancreas.
Pancreas. Pancreas is located at the back of abdominal cavity behind stomach. Pancreas is a mixed gland. It has both exocrine and endocrine part. The exocrine part secretes pancreatic juices which help in digestion. The endocrine part is called isolates of Langerhans after the name of scientist Paul Langerhans. The isolates of Langerhans are composed of 3 types of cells that are alpha cells, beta cells and delta cells. The alpha cell secretes my best friend, glucagon, which increases my blood level. Whereas the beta cell secretes hormone, insulin, which decreases my blood level. Oh no. Oh no, no, no. I'm insulin. Don't listen to him. I'm insulin and I'm very important to your body. Wanna know more about me? Let's see. Beta cell synthesizes me. These 2 Canadian scientists, Frederick G. Benting and Charles H. Best, discovered me. Looking into my structure, I am a soluble protein having 51 amino acids. This is acidic A chain having 21 amino acids. That is basic B chain having 30 amino acids. These 2 chains are connected by 3 disulfide bonds. 2 are inter and 1 is intra. I don't know why glucose hates me so much. I am necessary for glucose to reach and use by several important targets tissues like liver, muscle and adipose. I keep blood glucose level stable in the body. Insulin binds to tetramer insulin receptor and shows its effect in the cell. Insulin increases the number of GLUT4 receptor and stimulates glucose transport into the cell. I increase glycogen protein lipid synthesis and decrease ketogenesis in liver cell. I increase glucose entry, glycogen synthesis, amino acid uptake, protein synthesis, potassium ion uptake and decreases protein catabolism in muscle cells. I increase glucose entry, fatty acid synthesis, glycerol phosphate synthesis, triglyceride deposition, potassium ion uptake in adipocytes. Hope now you can see how important insulin, that is me, is important to your body. And those who still think I'm not important enough should know about diabetes. Due to deficiency of insulin, glucose does not go inside the cell but remains in the blood. If the blood glucose value becomes greater than the threshold value, glucose starts to excrete in urine. This condition is called glycosuria. These are the common symptoms of diabetes. In normal condition, type 1 diabetes, also known as juvenile diabetes, is a chronic condition in which pancreas produces little or no insulin. It appears in adolescence. Symptoms include increased thirst, frequent urination, hunger, fatigue, and blurred vision. Type 2 diabetes, also known as adult onset diabetes, in which the body shows resistance to insulin.
Good illustration on insulin by diabetes. Our next team is Charak Comrades, led by Shrishti Kishore from JSS Medical College, Mysuru.
Why meditation is medication.
We will be comparing the lifestyle of a person who meditates.
Meditation. Well-made animation by Charat Comrades. Our next team is Brainstorm, led by Ehsan Patel from Surat Municipal Institute of Medical Education and Research, Gujarat.
Please, no! 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 No!
I like it, cut G.
FBI, open up!
2,000 years later.
Run.
Concepts of immunity made fun by Brainstorm. Our last team of the day is Notes of Brilliance led by Jigyasa Gupta from Manohar Dental College, Faridabad, Haryana.
Greetings of the day. This is group Notes of Brilliance presenting to you our topic of the day, pain. So, pain. The word itself brings back the memories of all the bad experiences of our life. And according to International Association for Study of Pain or IASP, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Pain can be observed under following two types, fast and slow. Fast pain is due to the activity of myelinated A delta fibers. The pain experienced by this is due to a sharp and localized sensation and mainly felt in the skin. Whereas slow pain is due to the activity of unmyelinated C fibers, and this type of pain is appreciated as dull aching and more diffuse, felt in the skin and in deep tissues and organs. Based on the source of pain, there are three types of pain: superficial, deep and visceral pain. Superficial pain is arising from skin and mucous membrane, for example superficial cuts and burns. Deep or somatic pain originating from somatic structures deep to the skin, for example fractures and arthritis. Visceral pain. This is the type of pain arising from internal organs or viscera, for example irritable bowel syndrome or angina pectoris. Receptors for pain are called as nociceptors. They have free nerve endings that sense heat, mechanical and chemical tissue damage. There are three types of nociceptors, that are first mechanonociceptor, second silent nociceptor and third polymodal mechano-heat nociceptor. Gate control theory given by Melzack and Wall states that non-painful input closes the nerve gates to painful input, which prevents pain sensation from traveling to CNS. The gate control theory of pain describes how non-painful sensations can override and reduce painful sensations. It is proposed that efferent fibers of both small and large diameters carry information from the site of injury to two destinations in the dorsal horn. The small diameter fibers carry pain sensations, where large diameter fibers carry touch, pressure and vibration sensation. Therefore, less pain is felt when more activity in large diameter fibers occur relative to that in small diameter fibers. Now, let us talk about two different movements of pain: referred pain and radiating pain. When the sensation of a pain is experienced at the site other than the injured or diseased part, it is called as referred pain. In this, pain usually occurs between structures that develop from same segment during embryogenic development. For example, if a nerve gets pinched or pulled, it may hurt all along the nerve instead of just one area. One such example of referred pain is temporomandibular disorder, in which pain along with compromised movement of jaw joint and surrounded muscles is experienced. If the pain spreads from local area to a distant site, it is known as radiating pain, and sciatica will be a perfect example for this, where not only in the sciatic nerve but also the areas which the nerve supplies, that is one or both lower limbs, pains a lot. This was all about pain and its types, its receptors and the pathway it follows. Let us come to inhibition of pain or analgesia. Analgesia can be achieved by two mechanisms. First is stimulation-produced analgesia, and second is by release of endogenous opioid peptides. In stimulation-produced analgesia, the electrical stimulation of specific areas of CNS can produce reduction of pain by inhibiting pain pathway. The second mechanism followed for analgesia is by release of endogenous opioid peptides, which are enkephalins and endorphins. The terminals of substance P containing afferents possesses opiate receptors in the membrane surface. The two major opioid peptides, enkephalins and endorphins and morphine, bind to opiate receptors and produce analgesia. And with this, we conclude our presentation. Here are some references.
Pain Physiology made entertaining by Team Notes of Brilliance. Thank you all for watching the live streaming of All India Online Physiology Festival 2020. I hand over the proceedings to our Master of Ceremony, Dr. Divya. Thank you all.
Thank you, sir, for coordinating such a mesmerizing event. All the teams have given their excellent work. Congrats to every team and each and every participant who has participated here. Personally, I liked it a lot. Before going to ask judges' comment, we are having one announcement to announce that I request Dr. Mayank, senior resident and also the coordinator of this event, to announce that. Sir, please.
Good afternoon all. It has been brought to our attention that Team 100 Degrees and the Pulse from Savita Dental College, Chennai has plagiarized the video content that was already posted on YouTube. So we have a very strict and consistent policy regarding plagiarism. So we hereby disqualify Team 100 Degrees and Team The Pulse from Savita Dental College, Chennai. And I sincerely apologize, my heartfelt apology to the audience for the inconvenience caused, as the video was submitted during the last moment of the submission deadline, hence plagiarism was not thoroughly scanned. It is really disheartening for me as I pardoned them, the participants, for half an hour after the submission deadline was over. Anyways, if any other irregularities will be reported in further future, it will be reported to the judges and appropriate action will be taken. Thank you, and over to Dr. Divya.
Thank you, sir. Now to ask judges' comment, I request Dr. A.K. Jain, sir, Head of Physiology Department in MDMC College, to say a few words. Sir, please. Sir.
So please unmute yourself.
Yes. Still the speech is going on the other side. I have to switch off that. Just wait.
Yes, sir. So we can hear you loud and clear. Please, sir.
Oh, okay. Fine.
So your comments, please, sir.
I must congratulate everyone, one and all. They have infused their great ideas. Originality was maintained, and yes, thank you, ma'am. I have said the things. I think. Oh yes, it is.
So you were audible earlier, and I guess you muted yourself now.
Yes. Audible, madam.
Yes, sir. Yes.
Oh. I'm not very good, rather I'm bad with the computers. That is
We
my
all are. It's learning for all teachers around.
yes. And it is a nice, a very beautiful presentation all, and they have maintained everything. Had they been given the guidelines under which headings, these are the following headings under which they are going to be evaluated, the presentations have been further improved. And anyhow, the relevance to the physiology, everybody has maintained adequate, and composition by the participant was variable. They have not strict.
Yes, sir. So we can hear you.
So I wish best to the organizers, and it is a good experience for me also. And it is very difficult to make the animation unless and until you are very clear about it. So thank you very much.
Thank you so much, sir.
Thank you, sir, for sharing your thoughts. Thank you so much for your valuable presence here, sir. Now I request Dr. Manju Sabharwal, ma'am, Head of Biochemistry Department in GB Pant Hospital, Delhi, to say a few words. Ma'am, please.
A very good afternoon to all of you. And I want to first say thanks to Department of Physiology and Dr. Sunita Mondal for giving me this chance of being here and enjoying the animation made by medical students. So it is pretty new and I love the concept, and I hope in future also you will do something similar. As far as the animations go, like one thing I would like to tell the students, it's a very good start, a very good beginning. And I think the most difficult part is to begin, which you have done today. I loved most of the ideas that were there in the animation. And everything becomes interesting when it starts with a story. Even if it is medical education we're talking about and medical animation we're talking about. So everything must come with a story. And, a good animation starts with a good concept. And some of them really had a good concept, which was funny. It made you laugh, and at the same time, you learned a lot from them. So my congratulations to all of the students for taking part in this, program. And, you can take it further and do, more of it and enjoy both studying and, pursuing your hobby. So over to you, ma'am. Thanks.
Thank you so much, Dr. Manju. And I'm sure today, after listening to your credentials so far as animation and filmmaking is concerned, students would have been encouraged, massively encouraged. Because to pursue a full-time career and your hobby and doing both of them equally passionately is a forte that you've achieved. Amazing.
Thank you. Thank you.
Thank you. Okay. And Dr. Divya, I'm sorry, Dr. Jain and Dr. Manju. I guess Dr. Mandal is a little caught up in a meeting, so she's not with us right now. So in case she is free, she might join towards the end. Dr. Divya, please proceed.
Thank you, ma'am. I request Dr. Manvi Singh Mathur, postgraduate student in the Department of Physiology, to give a vote of thanks. Sir?
Thank you, Divya. It has been wonderful for past 2 days. We are overwhelmed with the response we got from all of you. Now, we have come to the end of another eventful day. I would like to thank our organizing committee and respectful judges, Professor A.K. Jain and Professor Manju Sabharwal. Last but not the least, I would like to thank audience for making this day a successful one. Thank you all. And we are looking forward to see you all tomorrow for miscellaneous category presentation. Bye-bye.
Thank you, sir. Thank you, Dr. Jain. It was truly an honor to have you with us. And thank you, Dr. Manju. And I hope you had a good time today. Enjoyed the animations.
Yes.
So
Yeah.
thank you.
Thank you. Thank you.
Thank you so much, sir, and thank you, ma'am.
So we'll take your leave and see you all tomorrow with on our last